guys, this is Dr. Khullar. Today we're going to talk about the most common question my newborn parents have. Why does my baby have nasal congestion and how do we treat it? So today we're going to talk about 3 causes that could be potential for reasons for the cause of the nasal congestion, and we're going to demonstrate the usage of the nasal Frida and other ways you can alleviate the baby's nasal congestion. So a few causes for the nasal congestion could be that the baby is just having noisy breathing, which a lot of parents don't realize. A lot of the babies do have small nasal passages, and any kind of mucus plugging can cause that noisy breathing. However, that's something that is important to be aware of. It's not something that needs treatment. I always suggest to the parents that it is a good idea when you do have a newborn baby to keep a cool mist humidifier in the bedroom. That really adds to the moisture in the bedroom, especially when you have the heater on or there's dry air in the house. It really helps keep the nasal passages clear and moist, so that way there is no mucus plugging. The most important thing to know about the humidifier though is to make sure you know the cleaning instructions and to clean it appropriately, since you could get mold in the humidifier if it's not cleaned properly. So make sure to do that. The second reason that you could have nasal congestion in babies is for a condition called GERD, or reflux, in newborn babies. So reflux can happen if you fed a baby and they're having a lot of that feed, that liquid feed, or any kind of mucus that comes from right up from the stomach back up to the nasal passages. And that can cause chronic nasal congestion in a baby. However, nothing is coming out of the nose and the lung sounds are clear, and you're not able to get any mucus out during suctioning. The history also suggests as well that the baby has GERD, which can cause a chronic nasal congestion. So that's important for you to discuss with your pediatrician. One recommendation I do have to prevent a lot of the reflux that can happen in newborn babies is if you keep the baby inclined after the feeding, particularly about 15 to 20 minutes should be good. This is important in adults as well, so it's common sense that after we eat, we don't want to lie right down. Same thing for babies, that if you were to keep them inclined at least 15 to 20 minutes, 30-degree angle, that would really help lessen the degree of the nasal congestion that can happen from the reflux. The third reason that you could get the nasal congestion is from a virus or from a run-of-the-mill cold that babies could have from the change of weather, or from a sibling, or from any respiratory droplet virus that they can catch. So when they do have something of this nature, what are a few tips to help them alleviate this or treat newborn babies? So a few things that I suggest is, number one, you could try steaming up the bathroom, and steaming up the bathroom so that way you could carry the baby in your arms and you could walk around the bathroom with the steam, which is very helpful for loosening up the mucus in their nasal passages. I mean, you could do this for about a few minutes, 5 minutes, but of course do it in a safe manner. The second way that I recommend is with, sometimes parents have been aware about this. This is a bulb suction. This is given in a lot of hospitals. This is given probably in a lot of baby showers. So there's the bulb suction that you could do on babies, and you want to make sure that you go on the anterior part of the nose and you suction out, and you empty it out before you go back into the nose. The only thing with the bulb suction is you have to make sure that you've cleaned it properly. You could get mold stuck inside these bulb suctions, so you have to be very careful with these things, or you have to use different ones often. They do sell some bulb suctions that are open, that you could open up and clean regularly, which I would recommend over this one. The third idea that you could do for treating your baby is the nose Frida, which has become very popular with a lot of parents, as well as the saline drops in the nose that are helpful for loosening up any mucus in the baby's nasal passages. Now, if the baby has mucus that is dripping down, there's no need for the saline. The saline's purpose is only to loosen the mucus. That's what I would do if you need to use the nasal Frida. So right now I'm going to show you how exactly you're going to go ahead and use the nasal Frida. Okay, So this is the box for the nose, Frida, and this is what we're going to be using for the nasal suctioning. And you're going to see that you have this syringe and you have this portion right here, which is the suction. And inside here, if you open it, you could see that there is a filter. So you could see the filter inside right here. So you want to go ahead and make sure that the cap at the end is pretty tight. And what you want to do, if you're going to use the saline, and I bought the Little Remedies saline, you're going to take the saline and you're going to put 1 drop of saline in each nostril to loosen up the mucus. And as soon as you do that, you're going to put the syringe on the anterior portion of the nose. You're not going to go deep inside. You're going to use this portion and you're going to suction. So you're going to put your mouth or your lips to it and you're going to empty it out. So I use this washcloth right here and I'm going to be suctioning it out onto the washcloth. Then you're going to do it on the other nostril. So you're going to put this on your lips and you're going to suction it out and you're going to push it out onto the washcloth. So hopefully that demonstration helped you get an idea of how exactly to use the nasal Frida. So once again, you're going to stick just this portion into the anterior part of the nose and you're going to suction pretty vigorously to get the mucus out. You're going to make sure that when you take it out of the nose, you're going to blow out so that way the mucus comes out onto the washcloth before you start suctioning again. So that's one of the biggest mistakes that happens. After you're done using this, you want to make sure that you clean these properly. So you want to use hot water, you want to use some soap, and you want to make sure that between usages, you change the filter that's inside after every use. And that would keep it pretty hygienic. So hopefully that was helpful for some parents of how to help your child who have nasal congestion. If there's any comments or any questions, please leave it in the comment section below. Make sure to subscribe and like this video so that way you can see more videos of this nature. And thank you so much for watching. Bye.